Health Minister Dr. Adam Baba said the cabinet will soon discuss the issue involving contract doctors who are still in limbo over their permanent placements. He said proposals to amend the contract doctor scheme were being prepared and will be presented to the cabinet soon. He also reiterated that permanent positions were awarded based on merit and performance in the master's degree. Because of that, I ask all doctors under the contract scheme to remain patient and calm, he said in a joint press conference with Science, Technology and Innovation Minister Kari Jamaluddin today.
In a country where public healthcare serves millions, how is it that those saving life every day are themselves struggling to secure a future? Hello everyone, my name is Nurul Nazirah binti Nazir with ID number 2024963047. Today, I would like to highlight the issue about contract doctors addressing the talent crisis among doctors in Malaysia. Imagine going through years of intense medical training, late night, long shift, and endless studying only to end up in a job where your future is uncertain. That's the harsh situation and reality facing thousands of contract doctors in Malaysia today.
A social media campaign known as #HatalDokterContract called for contract doctors to go on strike at the end of next month if the government failed to resolve the issue of their permanent placement.
Since 2016, Malaysia has been hiring many of its medical officers under short-term contracts. The idea was to manage the growing number of medical graduates, but over time, this temporary fix has turned into a long-term problem. According to a newsletter from CNA 2022, more than 23,000 doctors have been hired under contract with no clear path to permanent employment. These doctors work just as hard as their permanent counterparts, even often more during the COVID-19 pandemic. Yet, they don't enjoy the same benefits or job security. The crisis reached its peak in July 2021 when doctors nationwide joined the #HatalDokterContract protest. They walked out of hospitals not because they didn't care about patients, but because they feel neglected and ignored by the very system they serve. As the Star reported, many of them are stuck in limbo, unsure whether they will be offered permanent posts or be forced to leave the public sector entirely. Till 2021. This isn't just an employment issue, it's a talent crisis in our healthcare system. If we don't address it now, we risk losing an entire generation of skilled and passionate doctors. Next, we will talk about positive impacts for short term. From a government perspective, the contract system allows greater inflexibility in workforce planning. It enables the MOH to adjust staffing numbers annually based on budget constraints and hospital needs. It also temporarily reduces long-term financial obligation as contract doctors are not entitled to pension or permanent benefits. During the COVID-19 pandemic, this system allowed for the rapid deployment of medical staff, helping the government respond quickly to the national emergency. However, these benefits are short-lived and far outweighed by the negative consequences, especially in the long term. Let's talk about how this issue affects different groups, starting with the doctor themselves. For this contract, doctors, their biggest challenge is job insecurity. They don't know whether they will be renewed or promoted. Many of them can't even plan their futures. Things like marriage, buying a home, or continuing their studies are put on hold. A 2023 survey by the Malaysian Medical Association showed that over 60% of contract doctors reported that bullying, harassment and overworking was still prevalent. Another major issue is the lack of access to specialist training. Many contract doctors are blocked from entering postgraduate programs, which limits their career growth and Malaysia's ability to train more specialists. Now, how does this affect our hospitals and the healthcare system? Hospitals are struggling with high turnover. Once contracts end, doctors leave. Some will go to private sector and others to countries like Singapore and Australia where they are offered better pay and permanent positions. Azrul Muhammad Khalib, Chief Executive of the Galen Center for Health and Social Policy from article Code Blue 2023 said that this would be a big problem because Malaysia invests about 1 million ringgit to train a single doctor. When they leave, we lose that investment. For the government, this issue is becoming a political and reputational challenge. Public trust is slipping when people see the system as unfair and inefficient, especially after the protests and media coverage. And finally, this affects all of us, including the public. When doctors leave or feel demotivated, patient care suffers. In rural areas where contract doctors are often placed, shortage are even worse. These communities may go weeks or months without enough medical staff, so it's clear the consequences are serious and far-reaching.
Adham added that the government had previously implemented a salary adjustment for contract medical officers from grades UD41 to UD43, just one rank below permanent medical officers at UD44. It is nearly the same pay and grade as those appointed as permanent doctors. There is not much difference. However, the matter will be brought up to the cabinet and a decision will be made not long from now.
Now, let's explore what can be done to solve this issue. First, the government needs to gradually increase the number of permanent positions. It won't happen overnight, but there should be a clear, transparent system that allows contract doctors to be considered for permanent roles based on performance and need. According to the Malaysian Medical Association 2020 report, only less than 15% of contract doctors were offered permanent jobs that year. That is so not sustainable because almost 4,000 medical officers will lose their positions within the government service by May 2022. This will contribute to widespread job dissatisfaction and turnover. But according to the feasibility, the government doesn't need to absorb all contract doctors at once. Instead, it can phase in new permanent roles based on service needs and doctor performance reviews using HR existing structures. This will improve job security and morale for the employees while better workforce stability and continuity of care for the organisation. Higher quality and more consistent healthcare services will also be provided to the community and reduce brain drain and retention of trained local talent to the industry. Doctors who know they have a future here are more likely to stay and grow with the system. Second, there should be a structured career pathway. Doctors need to know how they can progress from house officer to medical officer and to specialist. According to the feasibility, Malaysia already has parallel programs like the Masters in Medicine (MDocMed). Standardizing entry requirements and pathways can be done through collaboration between MOH and universities. Impact on employees would be give motivation to develop skills and pursue long-term careers, while organisation can create a pipeline for future specialists. It will give better access to diverse and skilled medical services for the community, while more predictable talent development and workforce planning to the industry. Transparency builds trust. A clear path keeps doctors engaged. Third, we should explore partnerships with the private sector. Private hospitals could offer additional training slots or allow contract doctors to rotate between sectors. This would reduce the burden on public hospitals and help retain talent. This would be a greater impact for clinical exposure and skills development, while it can reduce burden on public hospitals. This can also broaden healthcare access through better trained doctors for the community, and integration between sectors boost healthcare system resilience. Fourth, we need to incentivize rural service. This could include rural allowance, housing support, or even priority for permanent roles. Doctors who serve in remote areas are doing some of the hardest work under tough conditions. They deserve support. This incentive can be budgeted regionally and aligned with the government's existing rural development agenda. This would give fair compensation for tough working conditions towards the employees and longer doctor retention in rural hospitals and clinics to the organisation, while consistent access to doctors in high-need areas for the community with reduced regional health inequality and improved rural health indices for the industry. Serving rural areas shouldn't be seen as a punishment. It should be seen as leadership. And finally, access to postgraduate training must be expanded. Without more specialists, our healthcare system will continue to struggle. Giving contract doctors equal opportunity to specialize is essential. Specialist shortage in areas like emergency medicine and anesthesiology are critical. Providing equal access to training will grow the specialist pool and improve care quality. Universities and teaching hospitals can collaborate with the MOH to increase intake or introduce blended learning formats for working doctors. This will give good impact for employees' career progression and job satisfaction, while increase availability of specialists for hospitals on the organisation. Better medical outcomes through specialist-led treatment would also be provided to the community, and industry would grow stronger and more diversified talent pipeline for Malaysia's future. A system that trains specialists is a system that saves lives. To wrap up, this issue started as a temporary solution but has now grown into a major national crisis. The contract system has left doctors feeling stuck, undervalued and burnt out. If we continue to ignore it, we risk it with weakening our entire public healthcare system. But the good news is, solutions do exist. With clear policies, more transparency and better planning, Malaysia can build a stronger, fairer and more resilient healthcare workforce. A healthy nation needs a healthy workforce, and that includes the doctors who care for all of us. We owe it to our doctors, which the very people who were on the front lines during COVID-19, who continue to serve our families and who are vital to the future of this country. And lastly, doctors should be saving lives, not worrying about saving their jobs. It's time we recognize that and act decisively. Thank you. The last page is about all references that I got from the article which I relate to for my contemporary issue. That's all from me. Thank you.